So 2 years ago, I came to St. John's to get on clinical trial. I was diagnosed with a stage 4 midline glioma that initially we tried to treat with chemo and radiation, and it was not effective. So our next move was to come out to California in search of a clinical trial. I started on the DC vax, but I wasn't a candidate for it. So we had to start over, and that's where we found ONC201. And I have been on ONC201 since 2022. So for 2 years now.
His is diffuse midline glioma, so a little different from glioblastoma, but we were on our 5th wedding anniversary trip in Crested Butte, Colorado, and he had tingly fingers on the left side. I'll let you.
Yeah, so out fly fishing on our anniversary weekend in Crested Butte, I started to feel tingling in my pinky and ring finger on my left hand, and didn't really know what it was. Thought it was maybe a pinched nerve or something, because I did a lot of weightlifting and stuff during that time. So I thought maybe just tweak something at the gym. And a couple of weeks later, was out fly fishing again and started walking like I was drunk back to the vehicle, and I was completely sober. So those were the first couple incidents where we started to notice the very initial side effects of the tumor.
Bryan went to the emergency room at Denver Health in Colorado. They did not provide an MRI scan at that time because he looked so healthy. They decided that he needed to see his primary care doctor for a nerve conduction study, which obviously, as Bryan was talking about, his symptoms continued to progress. So from the 2 left-hand fingers to the whole hand to the arm to, like he mentioned, walking back to his pickup from fishing, to the point where we were out with 2 of our friends to watch the Stanley Cup game, and foot drop started to happen. And on the way back to the cart, his foot was slapping the sidewalk, and we were really confused about what was going on then. So Bryan was able to get in to see Dr. Eddie at Colorado Brain and Spine. He took a look and said, this is, we don't know what this is yet, but there are 3 options, and I'd like to do something of a next step in 10 days. So you can either receive the LIT procedure, so laser interstitial thermal therapy, an open craniotomy, which is risky based on location of the tumor at the thalamus and basal ganglia, or just a biopsy. And our thought was we want to act quickly, and so Bryan and I had kind of the evening to talk about, and we moved on with the LIT procedure. And so Bryan was hospitalized in ICU for several days after the procedure, and then moved to acute rehab for close to a month in the hospital. And then it was after that that we began chemo radiation.
I think I had gone through most all of the chemo and radiation. I think it was towards the very end of the treatments that when I got another MRI and saw that nothing was changing.
Bryan received 30 radiation treatments from September 14th toward the end of October in concurrence with chemotherapy, temozolomide. And that was a tough process in itself, because when I have to wear gloves to provide the drug to him, that's something you're providing somebody that's pretty poisonous to their system, and he ultimately lost 50 pounds through that process. He left the hospital unable to walk, and Bryan has done amazing things since then. It's his own personal dedication to everything that he does and his own mindset. But he got pretty sick in December, and January 5th of 23 to his doctors there in Colorado, and they said, we're not sure if this is progression or radiation necrosis, but we need to make a move on next steps. His doctor said, do you know how serious this is? Well,
yeah, pretty aware.
Yeah, we were trying to rebuild and make next steps, and he said he gave this 16 months. We said no. We have a lot more to do than what we can do in 16 months, and that's not going to work for us. And can you afford to go to Southern California, where they consider this to be a sports center?
Decided then and there that it wasn't that doctor's call on when my life was going to end. It certainly wasn't going to belittle what life I had left. That was kind of the point where, like, however long it is, well, we're gonna do something. I mean, we're not just gonna sit around and have cancer. That wasn't an option for us. Never was and never will be.
So first we were at UCLA to see Dr. Robert Chong. He said, I don't think that you're a good candidate for DCVax, but I think you're a good candidate for Dr. Akansha Sharma's ONC201 trial over in Santa Monica. Bryan was very, very sick, in a wheelchair, gray, a lot of confusion from pain medicine. And when we came in, Dr. Sharma said that Bryan was facing mortality. That was easily the lowest point in both of our lives. And she, like an angel, I would say saved Bryan's life and mine.
Yeah, without question. You pretty much get handed a blueprint on how you're going to die. And you just kind of feel left on an island, like, you know, choice is yours. How do you want to proceed? And like, I don't know what's the best. You know, can we afford to go to California? We'll figure it out. Yeah, it sounds like we don't have a choice in that. So, yeah, just the whole journey to get out here was undescribable, really. Just very hard. But
well, the hospital in Colorado couldn't transfer his images out here for some reason or another. So two of my good friends lied about being my sisters to go get the images and overnighted them to us in a hotel here, and did all of this running around, and I can't even describe how it is to deal with insurance companies, mountains of insurance paperwork and waivers and etc. And so by the time we found Dr. Sharma, as sick as Bryan was and as tired and exhausted, and just the anticipatory grief that people deal with these sorts of diagnoses are leveling. And Dr. Chong, in helping us to find Dr. Sharma, total miracle, because honestly, that's the only thing that was available, the only thing for us to try to fight diffuse midline glioma. And because of it, and the clinical trial and the team and the process that we've worked with, we've been able to live again. And Bryan is living and doing the things that he loves, and we're living our life. And I have nothing but gratitude, sheer gratitude for Dr. Sharma and her team of people, because those were some really dark days, and they monitored everything closely. The problems that Bryan was facing in Colorado, Dr. Sharma was able to work to start solving immediately here through palliative care initiatives, through attention to shoulder subluxation that he was dealing with. When the right side of the brain is not recognizing the left side of the body, it caused some damage to his shoulder because he wasn't placed in a sling properly at the hospital right away as he should have been to receive PT for that. So that was almost more pain than the incision location he dealt with for his brain surgery. He went from being unable to walk to walking, and we've worked with a great physical therapist, Franny, in Colorado with that process. And now Bryan is doing all kinds of other outstanding things like photography, and it's really hard to watch somebody be that sick, someone you love, and they tell you there's nothing, and then there's ONC201 and Dr. Sharma. Our concern was, did not want a placebo. Like, we were on borrowed time and we need something that he wants to participate in this and wants something that'll work. So Bryan was provided ONC201 pills, and they basically are issued in a small white pill bottle, and there's 10 per bottle, and he takes 5 pills every Thursday at 12:25. And you don't eat 2 hours before or 2 hours after. So he's really hungry by then, and we didn't really think about the time, because when Bryan was issued the ONC drug and it was finalized and we were over here right across the street at the hospital, we couldn't open the lid and dump them out and get them in his mouth fast enough. We didn't care what time. So what we did is, now over lunch on every Thursday for the foreseeable future, Bryan's hungry, but that's whatever. He had the drug and the side effects. I mean, talk about that, Bryan, because that's so night and day.
If I had the choice between ONC201 from the beginning, it would have been a clear choice to do that first. My side effects from ONC201 are so minimal compared to everything I dealt with from chemo and radiation. ONC201 was easy to take, it was effective, and it saved my life.
He doesn't have nausea. The only thing I notice for side effect for Bryan is mostly tired. And you'll take tired over all the other things that we watch with radiation and chemo. So he usually sleeps for a little bit on Thursdays, and that was hard for me to get used to seeing my high energy husband tired. But this was way back from after surgery. But he had 4 Avastin treatments as you wait for the ONC to start working in your system. And the Avastin treatments we were able to receive in Colorado locally. They help to shrink your tumor location. And then it would have been May when we were back here in 2023, where Dr. Sharma said, we have a reduction in your tumor size. That was the best thing we'd heard. And then we
Ever.
Yeah.
So I started the ONC201 trial towards the end of January of 2023. And by March of 2023, I was already starting to feel better, do more things. It took effect almost right away. As my tumor was shrinking, I was able to gain more sensation on the left side of my body. My words weren't slurring quite as bad. I was able to start eating foods regularly again because chemo and radiation basically wiped out my taste buds. I wasn't able to eat anything. I was able to move, noticing that I could move my left toes a little bit and raise up my left shoulder more, and just these little movements that to most people wouldn't be significant, but when you're unable to move at all, going from no movement to a little bit, and then finally getting into a wheelchair by myself, and just doing all these little things, I started noticing that 2 months after starting, if that. I mean, it was pretty immediate. So started on coming out every 4 weeks, and I kept on getting 2, 3, 4 reports of reduction. So we knew it wasn't just one time. It worked once, that's it. It was continuing to work, so I went to every 8 weeks. And now today I come out here every 12 weeks to receive more ONC201 and do a review of my latest MRI to see if it's growing, reducing, what's happening. And ever since starting on ONC201, I've received at least stability, if not reduction, every time. And that is huge.
Yeah, definitely. And, the Avastin, they only use for just a brief time at the front end of the trial so that they can then ensure that it is the ONC201 that's addressing the tumor. And Bryan has just done so well on it. And it's always a lot of anxiety for us, the MRI and coming out and worried about what we'll hear. And As far as the team, we couldn't ask for a better team. They correspond with us, they meet with us. Dr. Sharma provided palliative care to Bryan, right off the bat. He received shoulder injections. So when you aren't feeling in pain every day and you eliminate pain pills and those sorts of things, your fogginess clears and you're able, to live. And so the onc has been a blessing in 100 ways. And, from our perspective too, it is a commitment to travel, but we want to see the best team in the country, and we are seeing the best team in the country. This part of California is considered a spore center for anybody faced with brain tumor and brain cancer. And I feel like Bryan's a testament to what's working there. What we have to do for the trial is Bryan we receive 6 small containers. Like he said, we come back every 12 weeks. We just have to bring those bottles back with us. We provide those to Francis, and then they evaluate his blood, MRI, and then refill his onc prescription, which is possibly going to be approved by the FDA in Q3 this year if Chimerix is able to keep that track moving. So Bryan's tumor started on optic nerve 1. And so it was really critical to slow it down because optic nerve 2 then is in the back of your head. So he started to have a screen door effect when we had come out here, the vision problems, we were worried he would go blind. And he has left side hemianopsia, so from here left on each eye, he's blind. But he's utilized tools through occupational therapy, to utilize whole movements. And the fact that the onc was able to slow the tumor down and back it off has helped to salvage his vision, which is crucial. He's a photographer, that's something that brings him a lot of joy and something he's very talented at doing. But not only did Dr. Sharma and the team coordinate Bryan's care to be on the clinical trial, but coordinated the palliative care and checked in with us, on various needs that he might have. And ultimately, Bryan was able to get off of pain pills completely and do other things to help for pain management and movement. I just thought, those things would be important to mention because it isn't just coming for clinical trial, but she helped to coordinate our resources locally in Colorado if need be. And that's amazing. Those are tools that we needed help with because we're just trying to survive.
From day one of coming out here, I was never treated and I never felt like I was just a number or just another patient. Dr. Sharma, Emmeline, Min, Francis, all of them will forever be family, and they treat us as such every time we come out here, and it's amazing. You don't find that everywhere in the country. Our first handful of doctors that we had, if they even had any sort of bedside training, just to find a great team of doctors, it's hard, and we did it. They're here.
Yeah, I asked some questions initially when Bryan was in ICU and was told, well, you're married for better or for worse. Well, actually, that's not the question I asked at all. I am kind of wondering what we need to do to plan. If he's unable to walk when we get home, we have stairs going into our home, and so that's something that I'm going to need to address. And so another question about, you sent us out here for a clinical trial without images. That would have been important to provide to someone. And, as we were told, Bryan has a terminal illness, you need to get out there right away. Those are all emergent things in my mind. Then you should provide the tools or help us know how to acquire the tools to get from point A to point B. That would have been great. When we're unable to receive that, you would get a lot more with honey than vinegar. Well, we know those things, but there's so many hurdles to healthcare and so many hurdles to get the care you need to live, and you're just trying to live and do that, find that resource that can help you do that. And they not only helped us both live and live a good life here. Dr. Sharma comes in the room, a smile, her light, her presence, and Bryan, you're doing so good. And that's, those are the things that lift you up, that help you get to the next step in your care, to take on what you need to do.
Yeah. I'm sure, like everybody that hears that you have cancer, you start to think of the end of your life. You can't help it. You start thinking about all the things that you'll never do again, all the things you'll never get to experience. And I'm here to correct my old self and to tell everybody that that is so far from the case. There is so much more life after cancer. And since coming out here, being on ONC 201, since I've been getting better, I'm able to go back and do the things that make me smile, like photography and being outside. And yeah, sure, I can't do all the same hikes that I used to, and I'm not carrying my own equipment for the most part. I have a fantastic assistant for that now. I have a lot of assistants to do most of the things that I do, but the point is I can do them, and I'm out there enjoying life and doing a lot of things that I never thought I'd be able to do again, and here I am doing it. I love photography. I love taking photos with my wife and just having a living journal of everything that we've done pre and post cancer diagnosis. And just that's more advice I would give to cancer patients. Just fight. That's half the battle, is your mental toughness, and you just got to do it. Go keep doing what you love, and everything will be fine.
A clinical trial allowed Bryan to continue to take photos and for us to continue to live our life, because where we started was, don't buy me another office chair, I'm not going to need it. And he was laying in bed, obviously really depressed, and I said, you can be in that space for 10 more minutes. I already bought you a chair and we have things to do. And we have things to do, and it truly is the clinical trial here at Providence St. John's that has allowed us to do that, because we had no other options, and we've got an amazing team here. And Bryan too, so many people say, gosh, what happened? You look pretty banged up, man, you're in a sling, or, every time at the airport, every time we're out, and Bryan deals with it really well. I would say things like, I would tell them I was in a motorcycle accident, or, nobody wants to talk about cancer every day. In part of dealing with depression and getting up and moving, one of his favorite bands, he started to listen to more of their music, August Burns Red, and then started to become more engaged in heart support as they help others who are dealing with mental illnesses. So Bryan has helped to fundraise thousands of dollars for the organization and is now serving as a board member. So my message too to other people is, your life doesn't stop. You have a lot to do and you have a lot to give, and Bryan's doing that through photography, and he's doing it through his commitment with August Burns Red and Heart Support Foundation.
My advice to them would be to stay strong and fight with everything you have, because your life is not over. And my first place I would start looking for treatment would be out here in Santa Monica with Dr. Sharma and her team. They've been nothing but a godsend to me. They literally saved my life. And though things are not the same as my life was pre-cancer, I love my life. I love my wife. I love that we're here together. We're fighting, we're doing it, and we still have so much more to provide. And being out here gave us that opportunity to do so. Not every doctor in the country has you in their best interest. Not every doctor has great bedside, and not every doctor is going to point you in the right direction. You gotta take initiative, be your own advocate, and speak up for yourself and do what you want to do to treat the illness that you have.
Truly look at your options. on where you seek treatment. The reason it's so critical is that if you are, there are many clinical trials and things happening now. So you're sometimes precluded from those options if you did not have your surgery handled at certain locations, because they may use tissue that was resected to help make decisions in where they're going to head next. And so in our journey, where Bryan's procedure and biopsy were handled in Colorado, we're thankful it didn't end up being a preclusive factor for us, but it could have been with a different diagnosis. So that's what I would say is you do have a little bit of time, and I would definitely recommend taking a look at Pacific Neuroscience Institute and Providence St. John's because they are teamed up with not only, I would say, the best providers in the country, to include Dr. Sharma, Dr. Kesari, Dr. Wagley, just to name a few. They're also dedicated to furthering the education in neuro-oncology and neurosciences in educational institutions across the country, which tells me they're on the cutting edge of knowing what clinical trials are available because they're participating and assisting and guiding many of those. So having your surgery out here, if that's what's required for you, or your assessment from the get-go, take the time to do it because I feel like some of the hurdles that we went through could have been avoided had we started here. But you don't know what you don't know. And it's a tough, complicated journey, and it's a lot to try to understand and soak in and just deal with because you're just a zombie and you're just trying to try every day for a while because you don't know how you're going to survive or live through this. You don't know what to do next, but you have to figure it out. And honestly, starting here, I think, would be the best decision a person could make. And at the time, it's so urgent. You feel like you need to decide right now. And we didn't feel like we had the luxury of time because ultimately his was located close to his optic nerve. So I would encourage people, if they have a little window of time, definitely take that and definitely start here if you're able to. It made a world of difference in the treatment Bryan received.
Every day is hard for different reasons, and part of during this whole process was all the night terrors that I would go through on a pretty regular basis. During that time, I started to lose vision in my left peripheral. It was also having trouble remembering things. So my night terrors consisted of me going blind and losing my memory and completely forgetting and not being able to see my wife. And that scared the hell out of me. Cancer is terrible in every sense of the word, but it is not the end of everything. You can fight it. You can find these clinical trials like ONC201 and you can restart your life. And we did, and we are.
As a wife and his care partner and advocate, I mean, you're fighting every day for him, but at the same time, you're watching someone be the most sick they've ever been in their life, but they're looking to you to see if everything's all right. So for most of the days, as the wife, you go in the bathroom and you cry in a towel. And you try to make another meal that might taste okay or that his taste buds are not completely messed up from the chemo so that he can eat, because you're watching him get skinnier and skinnier, and then, you know, talking to the phone on the phone with people to like, can he eat chicken broth? Can he drink any type of water? Because the last thing you want to do is bring the one you love to the emergency room, because in some places, you know, it's a petri dish of other infections, and that's not an option when your immune system's compromised. And then the other things that happen are when you're in an emergency room and no one's seen a patient with a brain tumor before, so 14 people who do not pertain to your case poke their head in to see what, there's all, like Bryan said, there's all these things that happen that we never expected any of this at the time. 40 and 41, his brain surgery was on his 42nd birthday, so there's no plan for how to deal with any of this, because we're in the prime of our life. I mean, we are doing and planning all the things that we wanted to do, where you don't think you'll have to deal with any of these things until you're 80 or 90 years old, and then here it is knocking on your door. I can't remember being asked how I was doing until Dr. Sharma and Emmeline and Francis and Jasmine and Yvonne and Min. We came in the room and they recognize I'm a person that's trying to, and I am not fighting the battle that Bryan's fighting. I'm fighting a different one alongside Bryan, and it's one that crushes my heart. It took me 35 years to find the love of my life. And I feel like after 5 years of marriage, it's a blow when you're going in for appointments like that. And so, yes, they have folded me in with open arms, and I feel I feel heard, I feel assisted. And Dr. Sharma, I follow so many of what items she has to write and share even online, but says, you know, if the caregiver isn't well, our patient's not well. And there's so much truth in that, and how we handle healthcare and medical, you know, in treating the whole family, so that I can do the things that I need to take care of us, and Bryan can do the things he needs to do to get better. But I feel thankful that they treat me as part of the team. I got called for jury duty. When am I going to do jury duty? Like, I'm caring for my husband who's extremely sick and working and managing meals and medication, etc. I called Emmeline. Oh, we can help you with a note for that. That was a leg up. That was one less letter and phone call that I had to make. Another time, he had to have a special paperwork in order to ride on a boat from a provider. They help with all of these things. I mean, I feel like it's been a total one-stop shop for us, you know, for questions, for dealing with problems, and just for helping you achieve wellness.
Absolutely. Most places like living in Denver, you go here to talk to this doctor, you go across town for your MRI, you go here for your medication. And here at PNI, it's all right here. And the staff, our doctors, everybody from reception to Dr. Sharma, top notch every time we're here. And it's rare. It is not common to have all that. You're just in a ball ready for you. And it's awesome. This place is insanely awesome.
To the point where I call Frances and she meets us with an Uber from the airport to provide the MRI CD for review. You just don't receive that kind of care. I mean, honestly, we love all the people. Dr. Wagley helped us one time on a Saturday, so I have a lot of respect for him. Bryan's first dose of the ONC 201 for the trial, we got home and we were still trying to feel out some of the pain medication as Dr. Sharma was working to manage his shoulder. And what really impressed us is we had an issue on a Saturday. Bryan became confused with some of the medication, confused about different locations in our home, and I was very nervous and called in on the Saturday line. Dr. Wagley answered the phone. He was amazing to work with. He was able to pick up from the work that Dr. Sharma had helped provide to Bryan, review Bryan's case, and said, yeah, this particular drug can cause some confusion. So we were able to taper that off, and I was just so impressed that somebody would answer a call and respond to us on a Saturday. Outstanding. They're a family.
Absolutely.
They're stuck with us.
Absolutely. For life.